Hi, friends. Dr. LeAnn here. I'd like to clear up some confusion about holistic medicine and alternative medicine and naturopaths and homeopaths and what does it all mean? So a lot of times there's nuances within these terms, and even within naturopaths, homeopaths, functional medicine doctors, everybody practices a little bit different. But there are two things that I hope will help you kind of discern as you make a decision. There's two things that I would recommend looking for um, as you make a decision about who you want to work with. So one is, you may have heard that the average office visit in America in healthcare is 5 to 7 minutes. I would avoid these types of practitioners no matter what they call themselves. The Latin word for doctor is teacher. And so your doctor should be teaching you. That's really hard to do in 5 to 7 minutes. In 5 to 7 minutes, you're not going to get a thorough health history. They're not really going to know you. Now, this is not to be offensive to people who that's the way they've been trained. And if that's what you're looking for, great. But if you really want to get to the root cause of your health issues, you need someone who's going to spend some time doing that. So that's number one. You're looking for somebody who does a consultation that involves some time with you so they can get to know, who are you? What's going on with you? What's your health history like? What have you tried? What's working? What's not working? The other thing that sort of lends itself to the second point is, you want to work with somebody who truly does have a holistic philosophy. Here's what I mean. A lot of natural or holistic or alternative medicine doctors actually use more natural substances, but they still use a very medical or allopathic model in the way they practice. So, for example, if you go to a standard conventional medical doctor for, let's say you have headaches, you're probably going to get some form of headache relief medication, right? This is what they do. They match a symptom typically with a medication to help alleviate that symptom. They do often work, right? You will feel better. But are you getting to the root cause of what's causing that headache? Now, the challenge is the same thing happens a lot of times when you go to holistic health practitioners of various kinds, is that they might give you peppermint oil or feverfew or some other herb. But I assure you, if you're having headaches, you don't have a peppermint oil deficiency, right? There's something else going on. If your headaches are because of dehydration, no Tylenol is going to help that, but also no peppermint oil is going to help that, right? You need to rehydrate your body. If you are dealing with, constipation, this could be from a food allergy. This could be from high stress. This could be from low fiber. This could be not enough exercise. So if somebody gives you, whether it's a medication like a Miralax or something like that from a medical doctor, or an herbal tea that would for sure be more natural, but you're still not getting to the root cause, then you're rearranging furniture on the Titanic, right? You're still going down. So what I really seek to do when I work with clients is figure out what's really going on with them and address that. So those are two things that will hopefully help you gain a little bit of understanding about, as you think through what you're looking for and who you want to work with.